Okay, so welcome to another screencast on the continuation of the Hemophilus and other fastidious organisms. And at this point, we will now be discussing the Brucella species. Brucella is the etiologic agent of brucellosis or angelant fever, which is a part of the so-called febrile agglutination test. Febrile agglutination test is a type of bacterial infection that could result in high-grade fever and could be diagnosed using the direct bacterial agglutination test. So if you could recall, this would include Salmonella, which could cause typhoid fever and could be diagnosed using the Widal test. The Widal test is not usually being done nowadays. Then second one would be the Rickettsia. Rickettsia could cause typhus fever. Okay, typhus fever, which could be diagnosed using the Will-Felix test. Then Francisella, which could cause the tularemia or the glandular fever. Then, of course, Brucella, which could cause brucellosis or the angelant fever. So all of these are part of the so-called febrile agglutination test. Okay? So Brucella is a zoonotic infection. Later on, you would be able to see what are the common reservoirs of Brucella. Since this would be acquired from animals or animal products. So the organisms could be found in urine or even in milk. So drinking unpasteurized milk would predispose you to have Brucella. So they are slow-growing fastidious organisms, could grow in blood agar plate, occasionally in McConkey. So tetracycline in combination with spectinomycin or gentamicin would be an ideal antibiotics. Okay, so these are the most common species of Brucella. These include Brucella melitensis, which is commonly isolated in human, Brucella abortus, Brucella canis, and Brucella suis. Once a pregnant woman has been infected with Brucella, this could result into abortion as a result of bacteremia. So the portal of entry would include the intestinal tract if you are able to ingest, any animal contaminated products, or the mucous membrane, or even the skin, so by means of direct contact. So angelant fever is otherwise known as the Malta fever. So this would be the other name for the angelant fever. Later on, we'll be explaining why do you call it angelant. And then, since it was discovered by Bernard Bang, so it is known as the Bang's bacillus. Okay? So remember Bang's bacillus, not the favorite site of you know who you are, which is Bangbas. That's different. Don't ever look at that in internet. That's bad, okay? So just remember Bang's bacillus. Okay, so this would be the 4 species of Brucella. Okay, Brucella abortus, the reservoir would be the cattle. Brucella suis, the reservoir is a swine. Brucella melitensis, the reservoir is the goat. And then Brucella canis, the reservoir would be the dog. Okay, so among the 4 species, the most severe is the one that is caused by Brucella melitensis. So there would be severe acute disease with complications. Brucella abortus would cause mild disease with suppurative complications, which is not really common. Then Brucella suis would have suppurative destructive disease with chronic manifestation. And Brucella canis would have mild disease with suppurative complications, which is also uncommon. Now, this is the reason why we call it angulant fever. So, the organism spread throughout the lymphatic system and bloodstream to a variety of organs, creating the hallmark of the disease, which is angulant fever. When we say angulant fever, the body temperature literally undulates between day and night and fluctuates between fever, normal, and subnormal. So, imagine this. So, sometimes the temperature would be very high or even sometimes would fall below the normal temperature, then would rise back again within the day. Okay? Or within the day and night. So, in a matter of less than 24 hours, your temperature fluctuates. So, that's the reason why it's called the angulant fever. So, imagine, a temperature could even become subnormal. So, the organism would strictly require CO2. Okay? The organism would be strictly aerobic, but some would require CO2. In fact, the ability of the organisms to require CO2 or not would be one of the bases of differentiating the 4 species of Brucella. So, they are non-spore-forming, gram-negative coccobacilli, non-motile, non-encapsulated, and they are considered as intracellular parasite, which means that it's hard for us to cultivate them in vitro. Okay? So, the biochemical test, let me go back to that statement. It's hard for us to cultivate them in vitro since they are intracellular parasite. But there is a specific culture medium that could be used for cultivating Brucella, and that would be the Castañeda medium. Okay. Anyway, biochemical tests, they are positive in oxidase, catalase, and they have this ability to produce hydrogen sulfide and urease, okay, which will help us differentiate it from other species. You can cultivate blood and bone marrow culture, though they are intracellular parasite. The acute and convalescent sera would allow us to further diagnose the disease. And if you are trying to cultivate this organism, it's kind of dangerous, so you have to have a specific biosafety cabinet categorized as type B. Okay, so that's the reason why most of the time, serological tests are safer, doing the direct bacterial agglutination test. So, a 4-fold increase in the antibodies between the acute, okay, and convalescent stage, or 4-fold rise in titer, okay, is considered as significant. Okay, so here would be the colonies of Brucella melitensis as shown in blood agar plate. Take note of the presence of the smooth, okay, raised, and translucent colonies. Okay, so interestingly, this is how we differentiate the 4 species of Brucella. So, in direct bacterial agglutination test, all of these would be helpful except for Brucella canis, since Brucella canis would usually have a negative result with this. Okay. On the ability to produce hydrogen sulfide, only Brucella abortus and Brucella suis would be positive for that. Okay? On the ability to hydrolyze urea, okay, Brucella abortus could hydrolyze urea within 2 hours. Okay? Then, in less than 2 hours. Then, Brucella suis could hydrolyze urea in less than 30 minutes. Same manner for Brucella canis. Though, Brucella melitensis would have varied result. Okay? Now, some would require CO2 to enhance the growth, and that would be Brucella abortus. Okay. Now, if we're going to add dye, thionin dye, Brucella abortus will be able to grow. If you're going to add fuchsin, it is only the Brucella suis that could grow. Okay? So, furthermore, Brucella is also differentiated from other species, okay, by means of these biochemical tests. So, you might read table 18-7 in your book. Okay, so another species, or another genus would be Francisella. Okay, another example of a zoonotic facultative intracellular parasite. It's actually non-motile, gram-negative Coccobacilli, strictly aerobic. So it can cause tularemia, or tularemia is sometimes known as the glandular fever or the rabbit fever. It is an acute febrile granulomatous disease with rapid onset and flu-like symptom. Okay, so it is more dangerous than Brucella. It's a category A. Okay, so it's a level, it requires a category A biosafety hood. So that's the reason why diagnosis is mostly made from serology, because culture is usually unsafe if you do not have a proper gear or personal protective equipment and the laboratory that would ensure the safety of the microbiologist. Now, that's the reason why serology is more preferred as compared to culturing of Francisella. So, Francisella is the part of febrile agglutination test. Okay, so there are 4 subspecies of Francisella. Okay, so this include the subspecies tularensis type A. Okay, so this is more virulent and transmitted by rabbits, sheep, and ticks. Okay, or this is known as the biotype A. Then another one would be the biotype B, the subspecies Holarctica, which could be transmitted by rodents and mosquito. And then the subspecies Mediacitica, and then the subspecies Novicida. It is somehow similar to tularensis, but not as lethal as the subspecies tularensis. Okay, so it's a gram-negative aerobic bacilli. So I did mention a while ago that tularemia is otherwise known as the glandular fever, the rabbit fever, or the deer fly fever, or the tick fever. So glandular because later on I show you that it would cause swelling of the lymph gland. Rabbit fever because rabbit is the most common reservoir. You could also get it by the bite of the tick, deer fly, or by the ticks. Okay, so that's the reason why frequent contact with contaminated rabbit would predispose you to have this. Though other animals such as rodents and arthropods such as ticks could be the responsible for the transmission of tularemia. Why call it Francisella? Because this one was discovered by Edward Francis in Tulare County. So this is a county in California. So there are 2 biochemical varieties which I did mention, the type A and type B. Sometimes it's known as the Jellison A or Jellison B. So as shown here are the different reservoirs of Francisella. So aside from the rabbits, mouse, fleas, chipmunk, okay, squirrel could be the reservoir of Francisella. Though humans are merely considered as an accidental host. So the organism is very small. In fact, it only measures about 0.2 by 0.2 by 0.7. So it stains faintly as a Coccobacillus and requires enriched media with growth, occurring after a minimum of 2 to 3 days of incubation. So the virulence factor is actually the organism is spread by contact with infected or contaminated animals or bites by insects or ticks. So Jellison A and Jellison B would be the 2 major biovarieties. Jellison A is mostly isolated in North America, whereas Jellison B is mostly isolated in Europe, Asia, and other part of Americas. So, biochemical properties, the Jellison A could ferment glycerol and citrulline uridase. Okay, the main source of infection of Jellison A would be the ticks and rabbits. In terms of severity of the disease, Jellison A is more severe. So, on the other hand, Jellison B or the Palearctica, okay, would be negative for glycerol and citrulline uridase. And the main source, let me correct it, it's not surface, it's source. So the main source of infection would be contaminated water and rodents. Less severe as compared to the Jellison A. Okay, so the organisms persist in an intracellular environment in macrophages. So that's the reason why it's called an intracellular parasite. So spread occurs through both the lymphatic and the bloodstream. So if you do not address it with antibiotic drug regimen, the mortality rate may reach up to 10%. So there. So the reason why we call it glandular fever is because of the swelling of the lymph gland, because again, because of the fact that the organism could be seen spreading in the lymphatics. So ulceroglandular means that you have an ulcer and at the same time lymphadenopathy. So the term lymphadenopathy means that you have a swollen lymph node. So majority of the cases would be ulceroglandular. Though when you say glandular, you only have lymphadenopathy but you don't have any ulcer. Then the third manifestation is typhoidal, which means that the organisms are only present, okay, mostly in the blood, okay, but it doesn't cause ulcer nor adenopathy. So about 5 to 15% of cases. And then oculoglandular means there is an involvement, and oropharyngeal means there is an oropharynx involvement. But then again, this one would be the most fatal and the most significant of them all. So this is the colonies of Francisella tularensis in chocolate agar plate. So take note of the presence of this one, the gray-white raised colonies with smooth appearance. Okay, so you have to incubate it for about 48 to 72 hours before you could possibly see the growth of Francisella tularensis in chocolate agar. Then we are now going to discuss another important species or organisms. This is the Legionella. Okay, so the etiologic agent of Legionnaires disease. Okay, Legionella pneumophila. Okay, could cause the Legionnaires disease. A mild form of Legionnaires disease is Pontiac Fever, which has the organism would have 14 serogroups. Where could we possibly find this? So it is present in environmental water sources, air conditioning system, respiratory secretions on objects that has been used by patients. The infection mostly affects immunocompromised individuals, so elderly individuals. So the disease has a large range from asymptomatic to deadly. So it also results from the inhalation of aerosols. So person-to-person via aerosol transmission has not been documented. So I'll tell you a story about this later on. So to detect it, you could have it culture. So you could use the BCYE. So later on, I will show you the picture of that. Or direct fluorescent assay by detecting antigen in the urine. Or you can use the fluorescent antibody staining or serological test. So, Legionella pneumophila is a motile rod-shaped gram-negative aerobic non-encapsulated non-fermentative organisms. It was first discovered in 1976 during a group of elderly men attending the American Legion Convention in Philadelphia, wherein 34 out of 221 people died, okay, from the infection. Okay. So, so the slides are repeating. Yan. So, here's the thing. During 1976 in Philadelphia, so the Legionnaires, or these are the old soldiers, okay, they had already retired, and they are, trying to catch up with one another by attending a convention in Philadelphia. They are billeted in a certain hotel, and that hotel would have, what do you call this, would have a centralized air conditioning system. So, there was an epidemic of a type of pneumonia that they have never seen before, in a sense that they cannot isolate the etiologic agent. So the bizarre thing about it is that only those who are Legionnaires are affected, okay, by this new type of pneumonia. Okay, those who are Legionnaires are only affected. So hotel staff and other guests are not affected. So let's say, for example, the bellboys, the waiters, other guests billeted in the same hotel are not affected. So what's with the Legionnaires? Why do you think they are affected? And how come that the disease is not transmitted from one Legionnaire to another? So investigation had started. They found out that it's so hard to identify the organism if you cannot isolate it until they find a special type of culture medium that could isolate Legionella. And this is what they call the BCYE, or the buffered charcoal yeast agar. Since they have discovered this culture media, they are now able to isolate the BCYE, and they found out that the organisms are primarily found in water. And this is actually traced to the centralized air conditioning system. So, if one Legionnaire is infected in a room, the bacteria travels through the air conditioning system and go to another room and infect another Legionnaire. And what's the common denominator among these Legionnaires? The common denominator is that all of these Legionnaires are old, therefore they are immunocompromised. And the organisms do not usually infect people who are healthy or with a very strong immune system. And that's the reason why, since it is a newly discovered organisms, they call it Legionella pneumophila. Okay? It's Legionella, not with someone whose surname is Legion or what. Okay. Legionella pneumophila. Okay. So, the incidence of disease with Legionella, the most common would be the serotype 1. Okay? So, there would be other species such as the Bonzemani, Dormani, Longbichi. Okay? But the most common, so there's another tricycle passing over. Okay, forgive me for that. But at any rate, the most common would be the Legionella pneumophila serotype 1. So, the bacilli are water-loving and can be found in heating towers, air conditioners, water, and plumbing. So, in the story of Legionella pneumophila, okay, neighbor's dog are barking. But anyway, the most common would be, in the story of Legionella pneumophila, the culprit for the disease is the centralized air conditioning system. Though, it says here that Legionella is also found in the soil. The organisms have few virulence factors. What will predispose you to have this? So, the predisposing factor would include smoking, chronic lung disease, alcoholism, immunosuppressive therapy. Let's say, for example, you have just a kidney transplant and you're drinking immunosuppressive drug, and then being old. Okay, so the organisms are intracellular parasites which means that even if they have already been engulfed by a macrophage, these organisms could still intracellularly multiply. Okay, that's not cool. So, Legionnaires' disease is a sporadic case, which means that it's community acquired and there would only be few incidents. Okay, but epidemic outbreaks could occur usually from air conditioners, like what happened in 1976. So, nosocomial infection usually happens among immunocompromised because of the contaminated respiratory equipment and aerosols. One of the top 4 pathogens in community-acquired pneumonia. So, what are these community-acquired pneumonia? So, these include Strep pneumoniae, Mycoplasma pneumoniae, Chlamydia pneumoniae, and the fourth one is Legionella pneumophila. Okay, so the incubation period would be from 2 to 10 days. Symptoms would include non-productive cough, fever, headache, myalgia or the muscle ache. It would progress to bloody or purulent sputum. So you'll have rales or crackling sound, difficulty in breathing, and shaking chills. So dissemination by circulatory system can occur. Eventually, the organisms will invade the kidneys, liver, heart, CNS, and lymphatic system. Mortality rate of Legionella pneumophilia would be about from 15 to 30%. So sometimes in a very severe epidemic, it could reach as high as 50%. So the most common culprit, as what I did mention before, was the serogroup 1. Okay, although serogroup 4 and 6 could also be implicated, or sometimes even the species make the day. Okay, so Legionella disease ranges from a mild flu-like illness, call it Pontiac, okay? If it's mild, Pontiac. If it's severe, Legionnaires' disease. Okay? So, mild flu-like illness to pneumonia and multi-system involvement. So, impaired cellular immunity or pulmonary function would predispose you to a more severe disease. So, Pontiac fever would have an incubation period of 2 days, a flu-like symptoms. You'll have fever, headache, myalgia that would last for about 2 to 5 days. But there is a spontaneous recovery. So it doesn't generally lead to death. And it is considered as a mild form of Legionella. The most common reservoir of Legionella would be aquatic sources such as lake, river, spring, man-made water treatment system. They could even survive in chlorinated water. So, specialized sources would include healing and cooling towers of buildings, fountains. So, probably can isolate it in a spa, okay, in jacuzzi, such. Okay, so they can colonize a variety of sources due to the fact that they have this ability to multiply at large range of temperature. Imagine from as low as 20 degrees to as high as 42 degrees centigrade. They could even survive in between 40 to 60 degrees centigrade. So imagine even in heating tower, you can still isolate Legionella. Adherence to pipes, rubbers, and plastics would also be common. They could even live inside a protozoan. So Legionella is such a versatile organism. Okay, so why do you call it intracellular parasite? Because they can even divide within a macrophage. So I keep on mentioning this, okay, predisposing factor for the disease. So might as well skip on that. Specimen. Okay, so predominantly respiratory specimen, bronchoalveolar lavage, sputum, bronchial washing. Okay, if you want to do the antigen testing, then urine specimen would be very useful, particularly for the diagnosis of group 1. Okay, it stays positive for a long time, thus it only confirms infection had already happened. So you may also do direct examination, okay, by staining the respiratory specimen. So you'll be able to see thin weakly staining gram-negative rods. Some of them are found within, or some of them are found as they are being engulfed by macrophages and neutrophils. Some of them are extracellular. So urine antigen test, direct antigen test would be the diagnosis. They are aerobic. They require L-cysteine, but they do not grow on ordinary media. So you'd be needing BCYE or the buffered charcoal yeast extract, wherein they will grow as small pinpoint colonies. So you acid wash a specimen to reduce contaminants with a mixture of potassium hydrochloride and hydrochloric acid solution for about 5 minutes. So you have to culture it for at least 7 days at 35 to 37. You'll be able to see grayish-white or blue-green convex wet-looking colonies. So if you want to confirm, you add L-cysteine. If the growth is enhanced, then you might as well use a molecular method for further confirmation. So this is an example of BCYE growth of the colonies. So addition of iron salts and cysteine in a buffered medium will enhance the growth of Legionella. Okay, another example of BCYE. This is the gram stain of Legionella. So if, as you notice, the thin rod could be seen extracellularly or intracellularly within a macrophage or a neutrophil. So these are the other species of Legionella. They are grouped according to the autofluorescence that they produce. Let me go back. Okay. So neighbor dogs are barking again, but anyway, don't mind them. So the yellow-green group, we have the blue-white group, the blue-white or yellow-green group, and the no-color group. Okay, hindi makulay ang buhay. So, Legionella pneumophila belong to the blue-green group. Yellow-green group. And this would be the summary for Legionella pneumophila. And the schema for the identification of Legionella organisms. Okay, so the yellow-green group of Legionella. So we could use the dye-30 silver stain or the direct fluorescent antibody stain for the detection of Legionella. Okay, so you'll be able to see the yellow-green fluorescence. Okay, so another example of DFA test for Legionella. Okay. So, for the antimicrobial susceptibility testing, we do not usually perform sensitivity testing. So, we use erythromycin in combination with rifampin as a drug of choice to be given to the patient, though alternative could include doxycycline, trimethoprim sulfamethoxazole, newer macrolides, and the fluoroquinolones. Now we come to hopefully the last group of the fastidious organisms, the Bordetella or the bordet ganguabacillus. Okay, a small strict gram-negative bacilli that could cause pertussis or the whooping cough. So the bordet gangua medium is the enriched media that consists of charcoal, starch, blood, albumin. Okay, and this would be needed for the cultivation of the Bordetella, which would have several species. Okay, so the major pathogens would include the Pertussis species, Bordetella pertussis, Bordetella parapertussis. Okay, both of these could cause whooping cough, though Bordetella pertussis is more common. Then you have the Bordetella bronchoseptica, an opportunistic pathogens which involve in pneumonia and even in wound infection. Say, parapertussis means like whooping cough. Okay, anyway, this affects both humans, though bronchoseptica would sometimes affect humans, but mostly affects animals such as dogs and pigs. Okay, minor pathogens include the species of avium, Hinzi, holmesi, and trematum. Okay, how do you get whooping cough? By breathing in aerosols that has been contaminated with Bordetella. Bacteria adhere in the cilia. Okay, it adheres in the cilia, in respiratory epithelial cells, and they are highly contagious. Okay, 90% of exposed contacts gets the disease. So that's the reason why you have to have a vaccine. DPT, remember? Diphtheria, pertussis, and tetanus. Now, who would be affected here? Mostly neonates or toddlers. Okay, because of their much weaker immune system. And adults are usually the carriers. Some adults do not have symptoms, and the tendency that they keep on cuddling these toddlers. Oh, cute mo, you pakis, and in doing so, you are transmitting. Okay, you are transmitting Bordetella to these kids. So, if you don't want these kids to get infected, then might as well have them vaccinated with DPT. Okay. Bordetella, remember, is also a toxigenic infection. Okay? Because as you can see, most of the virulence factors would include the toxin, namely the adenylate cyclase toxin, tracheal toxin, and LPS toxin, not to mention of the fact that they have this ability to attach to the ciliated epithelial cells. Okay? So, okay, moreover, still have the filamentous hemagglutinins. This one will facilitate the attachment of Bordetella to the cilia. Okay, the Pertussis toxin would be another virulence factor, aside from the ones that were mentioned in the previous slide. Clinical infection include whooping cough. What's a whooping cough? After you have cough, it's kind of like you are gasping for air. So, best actor. Anyway, that's how whooping cough would sound. You're trying to cough for air after repeated coughing. Okay? So, the coughing is so severe that most of the time, these poor neonates or these poor toddlers will not even have time to sleep or to eat because they're busy coughing. Okay? So, this usually happens during the paroxysmal stage because there are 3 stages of whooping cough. So, first of all, you'll be exposed to whooping cough. Okay? And then incubation period would about last for 1 to 2 weeks. So, the first phase is known as the catarrhal phase. Okay? This one is highly contagious. You keep on, the patient keeps on sneezing, they have this runny nose. So, at first, you might think that, this child has common colds, but eventually, it will now result into the second phase, which is the paroxysmal phase. So, this is followed by a cough with whoops. So, whoop means that you are trying to gasp for air. So, sometimes, the coughing is so severe that after you have cough, then you whoop, and then sometimes it is followed by vomiting. That's how severe it is. Okay, and then the paroxysmal stage would last for about 2 to 4 weeks. Then eventually, 3 to 4 weeks after, there would be diminished paroxysm, diminished coughing, and that's the convalescent or recovery. But if you're not able to recover, you'll have the complications, and this would include pneumonia, seizures, and encephalopathy. Encephalopathy, by the way, is dangerous because this now already involves the brain. So, whooping cough is a highly transmittable respiratory disease, and it has a high morbidity and mortality among young children. So, if children are inadequately immunized, so they are predisposed to have it. Since immunity is not lifelong, asymptomatic or atypically infected adults may act as a reservoir so that the infection is continued. So you could never tell if someone is a carrier because they appear to be healthy. So in order to protect your child, so might as well have them immunized with DPT. So serious infection in young children will result into cyanosis due to lack of oxygen. So sometimes need assistance in keeping airway open. So this happens in paroxysmal phase. Convalescent, as what I've told you, begins 4 weeks after the initial infection. So decrease in bouts of coughing but may take weeks or months for complete resolution. So specimen would be best from nasopharynx. So you may submit aspirates of fluid in the laboratory, or you could have the calcium alginate or Dacron swab, the nasal passages, okay? Or you inoculate it in a transport medium, Regan-Lewy transport medium, or directly inoculate it in the plate medium. Regan-Lewy is being used if the specimen is to be transported in a distant laboratory to maintain the viability of the specimen. Some laboratory would prefer to have a cuff plate. So sometimes they allow the patient to cuff directly in the plate. Though that's not as ideal as using the nasopharyngeal swab. Culture would be the Bordet gangua potato infusion agar with glycerol and sheep blood. So an alternative would be charcoal agar with 10% horse blood and cephalexin. Cephalexin will serve as an inhibitory substance so that respiratory flora would not be able to grow in the plate, so that you'd be able to isolate the Bordetella only. So also plate to blood agar plate and McConkie agar. So if you want to rule out Hemophilus, so use chocolate agar. So incubate the plate at 35 degrees and wait at least up to 7 days. So it's very long, 7 days. So you need to add moisture or humidity in the incubator to prevent plate drying. Yeah, you need to adjust the incubator for that. Okay, so you might as well read the summary of laboratory diagnosis of pertussis culturing. So the colonies, by the way, it's a gram-negative rad or Coccobacilli. The colonies appear to be smooth, silver pinpoint resembling mercury droplets. You may use DFA for confirmation or agglutination tests, which, by the way, would require a larger amount of organisms. Biochemical tests could also be used to differentiate species. So this is the mercury droplets of Bordetella as shown in charcoal horse blood agar. They appear like drops of mercury. Okay, so this would be the biochemical test to differentiate the 3 most common species of Bordetella, namely the Pertussis, parapertussis, and bronchoseptica. Antimicrobial susceptibility, erythromycin would be the most common and ideal antibiotics. So although azithromycin could be an alternative antibiotics for this. And that would be all for Bordetella. So I hope you enjoyed listening to my voice. Okay, and good luck to your exams. Okay, that would be all. Good night. Ciao.